So let's first talk about an S-lift. An S-lift is a procedure where a small incision is created and a small amount of skin is elevated to access this mass layer. And its most posterior aspect is then elevated. So it has its limitations because we're not able to remove a lot of skin. And although we can pull on this mass, we're only pulling on this mass quite laterally. So it's quite far away from the jawline and the jowl. So there's some limitations related to that. So who might be a candidate for that? Often it's people in a younger age group, so not necessarily under the age of 45, but that's a general guideline. Someone who has very slight laxity of the jawline, and perhaps slight laxity in the mid-face, or perhaps some slight laxity in the cheek tissues. Someone who's not an S-lift candidate is someone who has significant jowls, a poor neck angle or significant laxity of the skin below the chin, and also significant laxity of the muscles in the neck that cause sagging in the neckline. So those patients are unlikely to see substantial benefit from an S-lift. How the S-lift is performed is through a fairly small incision. You can see through the dotted line. Generally, the incision runs in front of the hairline where it's hidden the best. We want to keep the hairline where it is and move the skin up to that hairline. So this is the skin that is elevated. It's just a small amount of skin. We can access this mass laterally and then pull that up in an upward direction, and I think that's helpful. Distance from this mass where we're elevating it and the jowl or the platysma muscle in the neck is pretty far, so it's unlikely that pulling way up here is going to have a substantial effect here. So there are definitely limitations to that procedure. The steps of an S-lift are pretty straightforward. We make an incision, as I mentioned before, just in front of the hair and just in front of the ear, and then the skin is elevated. This mass is identified and elevated upward with stitches, and then any excess skin that is present is removed, and the incisions are closed with dissolvable stitches. What's nice about elevating a fairly small skin flap is the recovery period is pretty quick. So most people can probably get back to work within a few days after something like that. So the term, weekend facelift is sometimes applied to this, only of course if you have it done on the weekend, but there's a few days after the surgery where people kind of take it easy and lay low, but often they can get back to work with a little bit of camouflage. What are the risks in recovery with S-lift surgery? Bleeding and infection can occur, but of course with a small skin flap like this, the chances of bleeding are pretty small. Infection is a rare occurrence that we treat with antibiotics. Recovery is fairly short. We ask that people not do rigorous activity for about a week, but most people can return to work after a few days. So as with all these procedures, we want to talk about the risk-reward trade-off. In terms of S-lift surgery, it's probably the least invasive of the surgical procedures that we do, given that only a very small skin flap is elevated, so the risks are very low. Recovery time is quite quick, and most people can get back to work pretty quickly. So I think in terms of tolerance, it's a pretty easy procedure to tolerate. And what are the pros and cons of S-lift? I think, as I mentioned earlier, a small skin flap equals a short recovery, and I think that's the main pro of the S-lift is that the recovery time is very quick. The con, of course, is that the improvements that can be made through such a small skin flap are limited, and certainly you can't expect to have substantial tightening of the jawline or the neck through a very small skin flap and small incision. The other cons of this S-lift technique is that because we're performing such a small skin flap, there's limited access to this mass layer. So although it can be tightened, it can only be tightened in a very small area. The results are probably short-lasting. Much of the tension on the facial skin with an S-lift is on the skin itself, and skin tends to be fairly elastic and probably will stretch out with time more quickly than would be the case if the power of the elevation was done through this mass layer. In terms of risk-reward trade-off, I think with an S-lift, there's a limited amount of improvement that you get, but at the same time, you still have a very similar incision that you would see with a short scar facelift. So, I think the main benefit, of course, is the short recovery time, but I think given that you do have to have a small facelift scar in the area, it's not always worth it.